The news day continues here on One News Now. I'm Charles Lejano. The Health Department logs more than 7,000 new COVID-19 cases over the past 24 hours. This brings the country's total caseload to 1.1 million, some 61,000 of which are still undergoing treatment. More than 9,000 COVID patients have recovered overnight, while 204 died from the disease, as the country's COVID-19 death toll now stands at nearly 18,500. The COVID-19 reproduction number in Metro Manila has further slid. Data from the OCTA research group shows that the reproduction number in the capital is now at 0.67. This meets the ideal rate of below 1, according to the World Health Organization. The number signifies the average number of people that one infected person will pass the virus to. And if the downtrend continues, OCTA predicts a daily average of less than 1,900 new COVID infections in NCR by May 14th. The National Center for Mental Health has noted an increase in callers with mental health concerns during the COVID-19 pandemic. Jen Calimon with a report.
Via Toledo was diagnosed with anxiety and depression back in 2017. The call center agent was able to pull through the following years, but things changed when the COVID-19 pandemic hit.
Pero dahil sa pandemic, nawalan ako ng activities kasi nasa loob lang ng bahay. Pagdating ng gabi, hindi na ako makatulog. So pagdating ng gabi, andun lahat lumalabas ng ang pag-iisip, lungkot.
Toledo says she had also stopped seeing her therapist.
Hindi ko feel na safe pumunta ng PGH ngayon. And yun nga, nahihirapan akong maghanap ng doktor na kayang mag-check up sa akin or makapagpatin ako virtually.
Via is one of the thousands of Filipinos experiencing mental health problems this pandemic. The National Center for Mental Health says that from the usual 20 to 40 monthly calls before the pandemic, it skyrocketed to over 1,800 back in April. The usual subjects are anxiety and depression, as well as relationship and family problems. The NCMH says the most frequent callers are women aged 18 to 30.
At the start of the pandemic, syempre nandun yung feeling of uneasiness, anxiousness, nandun yung fear, no, nandun yung feeling of uncertainty, what's going to happen. Ang daming mga plans na naudlot, no, ang daming mga families or even individuals, no, na bukod sa nawalan ng trabaho, yung mga na-expose sa pandemic mismo, sa COVID virus mismo.
The pandemic did not spare minors too. Last month, about 700 minors called NCMH Crisis Hotline asking for help on studies and family problems.
It's very important to address also or to cater to their needs. Siyempre, iba ang reaction ng mga bata compared sa adults. It's very important to have that open communication with them.
Ongoko said that the crisis hotline provides different interventions depending on the caller's case, such as suicide prevention and referrals to their facilities. They're also offering the so-called psychological first aid, where a person experiencing anxiety or depression is advised to do 10 to 20-minute breathing exercises, relaxation, and walking. The NCMH is urging the general public to take care of their mental health by observing proper diet, getting enough sleep, and exercising. They're also advised to limit social media use, while also keeping constant communication with loved ones. For those dealing with mental health issues, the NCMH Hotline 1553 and other toll-free hotlines are open 24/7. Reporting for News 5, Jen Calimon. We are One News.
One lawmaker warns the Health Department about potential charges on the purchase of antiviral medication Remdesivir. Anak Kalusugan Representative Mike Defensor says new purchases of Remdesivir is, quote, reckless and foolish spending. Defensor explains that the government is scrounging for money to buy vaccines to provide cash aid for citizens. Recall that the DOH disclosed earlier that its Disease and Prevention Bureau had allocated another 1 billion pesos for Remdesivir. Defensor is among the chief proponents of animal drug ivermectin, which experts say has also not been proven effective against COVID-19. Biological differences between children and adults naturally lead to differences in vaccine dosage and reaction. But just how different will it be for children? And what are the expected guidelines for their inoculation? Andrew Picash from Johns Hopkins tells us in this Bloomberg report.
much of the biology of the immune system is incredibly different and very much dependent upon age. Even simple factors such as dosing based on body mass are all factors that have to be empirically determined, and that's why you see these clinical trials now that are focusing on children that are breaking down the age groups into smaller and smaller groups. Remember, adults were basically 17 and above, right? Right now we're going in age increments of about 4 or 5 years or so because of the challenges that are produced by trying to move into those populations with the limited amount of data that we have so far. So very important to get this right, because children represent a population that could really help us move toward a herd immunity sort of endpoint. But the studies that should be coming out next week are going to be very important in terms of understanding the dosing and the side effects in those populations.
And just to sort of tie a bow on this, if we do get those 12 to 16-year-old guidelines next week as expected, how quickly could we see kids start to get vaccinated, and perhaps how much does that accelerate the path to full immunity?
I think you can see vaccinations start almost immediately because the vaccine right now is out there. As we've all sort of been seeing, the vaccine demand is starting to diminish a little bit. And if we look at the initial rollout of the vaccine, my guess is that there'll be a large bolus of individuals who are very willing and want to get the vaccine that will line up very quickly. So I think that the rollout into children initially will be very fast and very high, and then it's really just then going to be a question of sustaining it and getting it to a high percentage, running into similar problems that we see now with the adult population.
Andy, what do you think the biggest issue is underpinning hesitancy at the moment?
I really do think it's getting the information to people in a way that they are comfortable understanding it. From a scientific standpoint, I really am amazed at the wonderful data that's coming out about these vaccines almost on a weekly basis right now. So the data is there. Communicating it effectively to populations is what's really important. And of course, getting at the issue of equity in vaccines, finding the populations that don't have access to it, that haven't heard much about the benefits of the vaccine. Getting to those populations is going to be the really critical thing right now.
Dr. Pekash, what do you think of New York City's decision to advocate for vaccine tourism, that basically if people come here to visit from other countries, they could get a vaccine and get first in line?
You know, more vaccinations are better. And everybody's trying to be, I think, creative about how to do this. You know, bringing someone into a country, vaccinating them. Remember, your effect of the vaccine then takes several weeks before you can actually, you know, get the benefits of that. So the timing of some of these things is important. And again, we're allowed to do a lot when we're vaccinated, but we have to remember that it takes some time for a vaccine to actually get you your protection. And so that's, I think, the critical thing to remember as we roll out some of these policies that may allow for greater travel or greater access to vaccines for people who are non-residents.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on Signal Play. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Charles Lejano. We're One News.